Count Corlin, and thanks to Sinn Féin for their work in putting together and tabling this motion today. I recently submitted 4 parliamentary questions related to disability services in Wexford. I asked the ministers to state the number of occupational therapists currently employed as part of the Children's Disability Network team in Wexford. The response stated that there are 3 occupational therapists currently in posts across the County Wexford CDNT. A total of 9 occupational therapists have been approved for Wexford. The HSE is experiencing significant staffing recruitment challenges at this time, which are impacting on service delivery. Last Count Corlin, the HSE and the Department of Health have identified the need for 9 occupational therapists in Wexford, and yet we only have 3, just 3 currently employed. That's 33% of what's required for the children of Wexford. In my first month in this House, Count Corlin, I raised the question of training and how the HSE advertised their staffing requirements across every area and communicated this to the 3rd level institutions. Yet, and at the time, the Count Corlin intervened with the Minister and demanded an answer, and the Minister's response was that they would rectify it and it would be fixed. And yet we still see only 3 colleges which are accrediting courses for occupational therapists. And the starting salary for an OT is €37,000. Sounds to the parents who are looking for intervention like a lot of money, but it's only 9% of the salary received by the CEO of the HSE, Paul Reid. Perhaps re-examination of the pay scales to reduce some of the obscene salaries paid to top executives and instead reallocated to better starting salaries for frontline areas might help with the recruitment crisis, Minister. It would certainly be more beneficial and an effective use of funds. In another PQ, I asked the Minister to outline the current number of children awaiting an appointment with the occupational therapist in the Children's Disability Network team in County Wexford and the period of time they had been waiting. Unfortunately, the HSE did not provide an answer to either of those questions. However, I can tell them. One of my constituents, Amy, whose little son has been waiting since he was 2, he's now 6, and that has had no appointment yet. That would mean the waiting time is 4 years. And this is not early intervention, last Count Corlin. It is pure and utter neglect. And I went on and I asked another question about the number of children currently awaiting an assessment with the CDNT in Wexford and the period of time each child had been waiting. And finally, I asked the number of children under the age of 18 currently waiting to be seen by CDNT and the autism services in County Wexford, and the length of time each child had been waiting and was on the waiting list. In response, I was told that the number of children waiting in Wexford pre-reconfiguration of the services was 445, and that this number is likely to increase. The response unclear as to whether this figure was in answer to my first question, to my second question, or to both. Now, I have to say this is pretty infuriating. Almost every dealing I have with the HSE services involves some major issue. Sometimes it's a staffing problem, sometimes it's a funding problem, or it's a problem of capacity or physical resources. All of it combined displays clearly to me that the HSE is in crisis and is being poorly led. The organisation's CEO, Paul Reid, earns more than the Minister and the Taoiseach put together. And what do we have to show for it? I don't see any evidence of improving outcomes for patients. I don't see value for money for the taxpayer. But what I do see are waiting lists getting longer and longer. And I'm pretty sure, last Count Corlin, that Paul Reid doesn't have to wait 4 years for anything. People in these situations on waiting lists for years, caring for children whose needs are incredibly difficult, for parents to meet without support from experts and specialists which they currently can't access. People are at their wits' end and trying to cope with no help in sight. I receive heartbreaking phone calls daily from parents like Amy, pleading with me to help and to see if there is anything that can be done for their child. These very people deserve the wellness conferences, but they aren't earning enough money to go on one. Their very tax contributes to the very large salaries of those in charge. These parents are barely keeping their head above water, trying to do right by their children. All they want is timely help and early intervention, but they're not getting it. Why can't we get it right for once? Why are we ignoring court rules that says it's wrong? Are we just going to ignore it and give somebody else a pay rise that might deflect from the seriousness of this situation? I have to say, Chair, this is utter and total negligence by the hierarchy of the HSE, and more so this government for allowing them to get away with it without accountability.